Hello everyone, welcome to SK Nursing Notes. Today I demonstrate female pelvis. The female pelvis consists of 4 bones, 2 innominate bones and 1 sacrum, 1 coccyx. 2 innominate bones have 3 parts. This is ilium, this is ischium and this is pubis. And the parts of the ischium are ischial crest, iliac crest and iliac fossa, anterior superior iliac spine, anterior inferior iliac spine, and in posterior side posterior superior iliac spine and posterior inferior iliac spine. This is then part of ischium. This is ischial tuberosity, this is ischial spine, and this is acetabulum, this is obturator foramen, and this is the greater sciatic notch, and this is lesser sciatic notch. This is the part of ischium. Then part of pubis. This is the superior rami and this is inferior rami. This is pubic arch or pubic angle and this is symphysis pubis. This is the part of pubis. Then part of sacrum. This is sacral promontory and ala of sacrum, hollow of sacrum and sacrococcygeal joint and coccyx. And this is also sacroiliac joint. This is the part of sacrum and coccyx. Then we know about the joints. There are the 4 joints present in the pelvic bone, 2 sacroischial joint, sacroilium joint and 1 sacrococcygeal joint and 1 symphysis pubis. Then discuss about the ligament, interpubic ligament between the 2 pubic bone, the interpubic ligament, and then sacroiliac ligament, sacrum and ilium ligament, and sacrotubercle ligament, sacrum to tubercle. This is the 1 ligament, and sacrococcygeal ligament between the sacrum and coccygeal bone, and also the sacrospinous means the sacrum and spine ligament is present. This is the 6 ligaments of the pelvic bone. Pelvic brim. This is the pelvic brim. The landmark of pelvic brim is symphysis pubis, then pubic crest, then pubic tubercle and pectineal line and iliopubic eminence. This is called iliopubic eminence, and this is iliopectineal line, and this is sacroiliac joint and anterior part of the ala of sacrum and also the sacral promontory. This is the boundaries of the pelvic brim. One is symphysis pubis, pubic crest, pubic tubercle and pectineal line and iliopubic eminence and iliopectineal line, sacroiliac joint, anterior border of ala of sacrum and sacral promontory. Then pelvis are two types. One is false pelvis and one is true pelvis. False pelvis means in which the obstetrical significance are less and which present upper part of the pelvic brim. This part is called pelvic brim. The upper part of the pelvic brim is called false pelvis, which mainly bounded by the anterior abdominal wall, posteriorly spine or vertebra, and in the lateral side iliac fossa. So this is the boundaries of the false pelvis. Then part of the true pelvis. True pelvis are divided into the 3 parts. One is inlet. Mainly in the true pelvis or pelvic brim is called inlet of the pelvic bone, and this is the cavity, and this part is outlet. And then we discuss about the diameter. There are 3 types of mainly diameter present: anterior posterior diameter, oblique diameter and transverse diameter. In anterior posterior diameter in inlet means pelvic brim. This anterior posterior diameter is the distance between the midpoint of the sacral promontory to the inner margin of the upper border of the symphysis pubis. Means from this to this distance is called anterior posterior diameter. This is also called true conjugate or anatomical conjugate. Then in the oblique diameter distance between the sacroiliac joint means sacroiliac joint to the iliopubic eminence. This distance is called oblique diameter. And transverse diameter is the distance between the iliopectineal lines, means highest distance between the iliopectineal line. This is the transverse diameter. And in the conjugate diameter or true anterior posterior diameter, there are 2 others. One is obstetric conjugate and diagonal conjugate. Obstetric conjugate is the distance between the midpoint of the sacral promontory to the midpoint of the posterior part of symphysis symphysis pubis, means this point to this point is called obstetrical conjugate. And in the diagonal conjugate distance between the lower border of the symphysis pubis, means this part to this part is called diagonal conjugate. Okay, this is the diagonal conjugate. So in the anterior posterior, true conjugate is 11 semi, obstetrical conjugate is means this point to this point is 10 semi, and diagonal conjugate is 12 semi, and in the oblique diameter 12 semi, or in the transverse diameter is 13 semi. Then the diameter of the cavity,